What's going on, guys? Today I'm going to be talking about a total shoulder replacement. The main goals of this procedure are going to be to provide pain relief as well as increasing the range of motion in the shoulder. I can't tell if I'm too close to the camera or not for this. If I am, let me know in the comment section and I'll change that next time. But for a total shoulder arthroplasty, what you're going to be doing is you're going to be replacing the humeral head and the glenoid cup. They're going to be doing this by a deltopectoral incision that's going to remove and then reattach the subscapularis tendon. For this, you're going to need to have functioning rotator cuff muscles to provide that stability post-op to make sure it doesn't easily dislocate anteriorly or anything like that. But if you don't have properly functioning rotator cuff muscles, an alternative is going to be a reverse total shoulder arthroplasty. And this basically reverses the mechanics we normally have to where instead of a humeral head glenoid cup, you're going to have a humeral cup and a glenoid head. But that's information for a different student's video. If you want to learn about that, go somewhere else. For a total shoulder arthroplasty, you're going to be immobilized in a sling for about 12 or so weeks, just to make sure it doesn't dislocate anteriorly, like I said. But a couple of the precautions that they have are going to be no external rotation, meaning no going out to the side like so, no glenohumeral extension, so no having the arm going back. And for this one too, it's highly recommended to kind of put a pillow underneath your arm while you're sleeping to make sure that your arm isn't going back too far, but it's kind of at the same level as your rib cage there. So those two things, as well as non-weight bearing, are the three common precautions to have. These typically vary per surgeon and it all depends, but those three are going to be pretty standard for everything. But a typical activity that's going to be disrupted or limited day to day is going to be putting on a shirt. I'm sure all of you have put on a shirt before, but this is going to be changed up a little bit post-op to where normally when people put on a shirt, I don't know how everyone puts on a shirt. Apparently there's a couple different ways, but what you can do is up here, and then as you're coming up here, you're already violating as you're kind of extending a little bit, as well as doing a little bit of external rotation as you're coming out here. So post-op, you're gonna have to change your shirt putting on abilities to where a good way to start is going to be having the arm hold kind of close up to the bottom like so. And like I said, you're gonna have to avoid external rotation as well as extension. So the best way to do this, I think, is going to be having the armhole ready and kind of just guiding your arm in through there with your non-operative arm, kind of just pulling that up a little bit, then using your non-operative to kind of do all the work here. Adjust as according, and bam, you have a shirt that is on. It might be easier to use kind of a button-up shirt for this too, to kind of just have the arm hang in there and you can guide it through and then pull it around as opposed to pulling it over. In terms of putting on the buttons though and attaching those, I would check with the surgeon and their protocols to make sure that you're able to have the button up like so, because some, I imagine, may not want you having your arm moving much at all. So like I said, check with the protocols the surgeon has in place for you, but those three ones I listed are going to be the main factors for all of them. So that's about all I have for you. Like, comment, and subscribe, and I'll see you next time.